Hello, welcome to another edition of Early Years Matter Conversations. This is Matthew Hansen. I'm here today with Dr. Kate Gallagher, Director of Research and Evaluation at the Buffett Early Childhood Institute, and Dr. Alex Daro, Research Specialist at the Buffett Institute. Thanks for joining me today, guys.
Thanks, glad to be here.
We are talking about the survey that you just completed today of the state's child care providers. Widespread study. I think it's fair to say that it shows that child care providers in the state of Nebraska are economically and emotionally staggered 4 months into COVID-19. What do the results tell you guys about how they are doing 4 months into the pandemic?
Well, thank you, Matthew. So in this survey, which is the second since the onset of the coronavirus, we heard from over 1,000 licensed childcare providers across Nebraska, about a third of all the licensed providers in the state. And about 3/4 of our respondents were family childcare home providers, and another quarter were childcare center providers. And our purpose of this survey was to see how providers were doing several months into the pandemic. And we really wanted to elevate their voices and their needs. So regarding how providers are doing financially, I think it's important to note that in Nebraska, most of childcare providers have remained open during the pandemic. Now, this has been a lifeline for families with essential work. But if the pandemic continues or worsens, over half of these providers surveyed report that without financial assistance, they would probably or definitely close.
Yeah, and that's a thing that obviously jumps out from reading the survey, and it seems disastrous for the state's businesses, the state's families, the state's kids, the state itself.
Absolutely, Matt. And we had some good financial news also, that in private funding of the $1,000 small grants were available to over 1,000 providers statewide. And we heard from many of those recipients of those private funds who told us they were using those funds for cleaning supplies, food for children, rent and mortgage, and more so for programs payroll. And about 1 in 3 of these providers also applied for and received federal funding, such as small business loans and paycheck protection. But over half of them didn't apply. And childcare centers were more likely to have a relationship with a local bank to help apply for those funds. So that is some good news, and Alex will share with you some good news on how providers are doing financially.
Thanks, Kate. So as Kate said, we found that the majority of providers responding to our survey are still open, but they are reporting that their enrollment is down pretty much across the board. Our respondents reported that 1 in 4 home-based and 1 in 2 center-based providers are operating at 50% of their pre-pandemic enrollment or less. And of course, with a decrease in enrollment comes a decrease in income. And we found that 1 in 5 home-based providers and 1 in 3 center-based providers reported that their income had been reduced by half or more. So while as Kate said, there has been some well-timed help, providers are still struggling financially and are very concerned with making sure that they can provide care for families and children.
So again, it seems clear that this is a potential, economic crisis for childcare providers. And sadly, that's not the only serious issue that the survey identified. Kate, what did providers survey tell you about how they're doing with the stress and other emotional challenges that come with trying to care for children during COVID-19?
Yeah, Matthew, the effects of the pandemic are, in the words of these providers, taking a toll, and not just economically. Providers are under incredible stress caring for young children in this context. So as a premise to how they're doing, to their current well-being, few providers reported having sick leave to recover from COVID-19, should they contract it. And unfortunately, most providers are seeing the stress in their well-being. Physically, they're experiencing sleep disruption and difficulty concentrating. Emotionally, they're experiencing feelings of isolation and loneliness, lack of control, and anxiety about the future. Almost half of them have experienced feelings of sadness and depression, sometimes or most of the time. And while all these changes and feelings are things that most of us are experiencing in the pandemic, these providers are in high stakes jobs.
Yeah.
They're taking care of groups of children at a time when young children's brains are developing so quickly. So this is hard work. And yet, in a remarkable Nebraskan fashion, when we ask them about the resilience and coping, they are coping well. The overwhelming majority, 90% and more, sometimes or most of the time, they're having the ability to recognize their stress and regulate their feelings. They're seeking out information to address concerns, and they're taking part in physical activity to remain healthy. So Matthew, these care and education providers are nothing less than heroes.
These risks to childcare providers, I mean, the economic risk, the health risk, the mental health risk, clearly aren't over. And that's, a big part of the problem here and a big part of the uncertainty. Alex, what are providers saying they are worried about as they look to the winter, to the fall, and to the winter?
That's a great question, Matthew. So as providers are looking to the fall and winter, they are mostly concerned with keeping their programs, their businesses open. So as a reminder, over half of providers that responded to our survey indicated that without financial assistance, they would probably or definitely close if the pandemic continues or worsens. So I'm going to just say that one more time. 1 in 2 of these providers could close if financial assistance is unavailable and the pandemic continues or worsens. So our home-based providers are wondering how they can keep paying for their homes. Our center-based providers are wondering how they can keep paying their staff. All providers are worried about keeping the lights on, paying for cleaning supplies and food. Providers are also worried about how they can manage and reduce their stress. Many mentioned feelings of stress and uncertainty, and they're looking for ways that they can learn how to reduce that stress. The good news is that there are some things that are already in place throughout the state to help with enrollment. There's the new Nebraska Child Care Referral Network, and that can help match providers that have open spots with families who are in need of care. To help with income, there are grants being offered through Nebraska's Department of Health and Human Services and the Nebraska Children and Families Foundation. And there has also been a change to the child care subsidy guidelines that allows providers to bill for days when children who are on subsidy are absent. One provider credited the change in child care subsidy with saving her business. So there are things that are in place that are really helpful for providers, and we'll make sure we link all these resources below. So even though providers are concerned about the future and whether or not they can stay open, we are very hopeful that there will be enough resources in place to help them be successful.
Thanks for answering my questions today, guys, and thanks a lot for doing this survey.